Okay, so I just wanted to go over this for anyone who's still having issues with it, just because I feel like I understand it pretty well, and I hope that I can help somebody. Okay, so basically, the first things first, before we can start, you have to know the difference between an optic nerve, an optic chiasm, and an optic tract, right? So the optic tract, right, would be this area. Okay, this area, right? So this would be our right optic tract, right? And then this would be our left optic tract, okay? And then this area to this area, these are optic nerves, right? So this is our right optic nerve, and then from here to here, this is our left optic nerve, right? And this is really important because it means a very different thing if somebody says you have a lesion over your right optic tract, right? If you have a lesion over the right optic tract, the lesion would be here, right? But then if they said you have a lesion on your right optic nerve, compressing your right optic nerve, that would be here, okay? Very different results for your vision, okay? So that's the first thing that we kind of have to define, right? So I'll go ahead and erase these. And I'm going to keep the right and the left so that we can just kind of look at them and be aware of them. And then the next thing is temporal fibers, right? So these temporal retinal fibers, right? And then same things here, temporal retinal fibers, right? So that is this is what I'm talking about. It's this area right here. Okay, that's what the retinal fibers are, is the actual part of the retina that is going to be supplied by these fibers, by these nerves, right? And then you have, on the other side, you have your nasal retinal fibers, right? Nasal retinal fibers. Okay? Now, yeah, so now we can actually start talking about how the fibers travel through the eye, right? And the chiasm, right, is just the spot where things are going to cross, but not everything crosses, okay? So before anything, what I would do is I would draw this out. I would draw just the temporal parts out. Okay, why? The temporal parts do not cross. Okay, so your lateral fibers of your left optic tract, right, are going to then run still on the left lateral side and become part of your left optic nerve. And then they supply your lateral or temporal retinal fibers, okay? The only thing that's actually super weird is when we talk about the visual field from this, right? So the visual field from this will actually come up and actually provide you with your nasal visual field, okay? And specifically, the nasal visual field of your left eye, okay? Now, the same thing is true for the right. The right optic tract, the temporal fibers or the lateral fibers, are going to go to the optic chiasm and they're not going to cross. They're going to stay on the right side. So they're going to stay and become part of the right optic nerve, and then they're going to supply the temporal fibers of the retina. Okay. Again, the only weird part about this is that it's then going to supply the right nasal visual field, right? So left temporal retinal fibers supplied the left nasal visual field. The right temporal retinal fibers supply the nasal visual field of the right eye, okay? Then we can talk about the more medial fibers, right? So now we have these fibers from the right optic tract, the nasal side of the right optic tract. Okay, so we're on the medial side of the right optic tract. It's going to go hit the chiasm, and this time it's going to cross over. So the nasal fibers of our right optic tract are becoming the nasal fibers of your left optic nerve. Okay, and then they supply the nasal retinal fibers here of your left eye. Okay, so right optic tract nasal fibers cross over and become the nasal fibers of your left eye. Okay, and then this is going to actually supply the opposite vision here. So we're going to have left temporal visual field. Okay, so that means that our nasal retinal fibers of our left eye supply our left temporal visual field. Now the opposite is true for the other eye. So basically our left optic tract crosses the optic chiasm and becomes part of the right optic nerve to supply the nasal retinal fibers of the right eye, so the right nasal retinal fibers, and then those are going to provide vision for the right temporal visual field. Okay, so now that you know that, it will be very easy to figure out where damage happens, right? And what kind of visual field loss you're going to have depending on where that damage is, right? So the first, thing is you have a tumor that is pressing on your optic nerve, okay? Let's say your right optic nerve, okay? That would be a lesion right here. So let's say you have a lesion right here, right? So what would happen? Well, the supply that these two would give, this guy and this guy, right, would no longer be there. And so that means that this visual field and this visual field will be knocked out, right? So right nasal visual field and right temporal visual field are gone. That means that no vision in right eye. Okay. Now let's go back. There it goes. Okay. And let's talk about a different kind of lesion. Right? So let's say instead we had a lesion on instead of our right optic nerve, we had a lesion on our right optic tract, right? So now this is where our lesion would be, right? So we have this lesion here, okay? And so then we could just follow the fibers, right? So we're following it here, here, here. And I noticed that my right temporal retinal fibers are affected. And then let's follow the other one. This one actually goes all the way up here, and then that makes our left nasal fibers affected, right? And so then that would mean if we follow the vision, we would have no vision on the left temporal field, and we would have no vision on the right nasal field, right? And so that would mean that if you saw a picture of what the field would look like for this patient, right, then these would be black. They would only be able to see the they would only be able to see the nasal visual field on their left eye and their temporal visual field on their right eye. So yeah, that's what that would look like. Right? Let's see if I can just do this. Yeah, that's what I thought was going to happen. Alrighty. Okay, so then let's talk about one more, which is the one that I think they're going to give us, but I can't be sure. And that would be what would happen if you have a pituitary issue, right? So our pituitary gland is actually directly under here, right? And so if we had something pressing right in the center, right, it wouldn't affect our red lines here, wouldn't affect our temporal fibers, right? It would only affect our nasal fibers. And so if it's only affecting our nasal fibers, then we will end up having issues from here on, right? So I will go with a different color. So basically we would have issues here and issues here, right? Both the nasal sides. And that would cause loss of visual field here and here. What would it look like? What would it look like? We would end up, right, blocking out the temporal sides of both of our eyes, right? Now imagine if, you know, that we pretend like we see these little circles. We don't. We see, you know, nothing here, nothing here. What does it look like? It looks like a tunnel vision. Yep. So that would basically be the questions that they would ask. You know, they could get fancy if they wanted and just say like, okay, well, you know, there's some structure near here. It's going to press just on the temporal side. But as long as you can draw this document, you should be able to figure out which one it's supplying, right? And that's the most important thing. Okay, hope this helped. Bye now.